Okay, this is a very important topic about self-injury. This is something that seems so much, so prevalent in the clinical setting. So the behaviors include cutting, scratching, maybe burning, interfering with the healing of wounds, hitting or biting oneself, head banging, and hair pulling. And these are done without the conscious intent of suicide. So, when if you have someone who comes into the emergency department and they've cut themselves, sometimes it's hard for us not to think a suicide attempt, but this is done for a totally different reason. It's referred to as New Age anorexia. It's self-injury, self-harm, self-mutilation, and it's drastically on the rise, especially amongst adolescents. It is a coping skill. It's just maladaptive coping skills, and it occurs in about 4% of the general population. It is also one of those things that can be very secretive, and numbers of males and females. It can occur in both groups, but it's more common in females. Typical onset is puberty and often lasts for 5 to 10 years, but it is a very addictive type of treatment and very difficult for folks to stop once it started because it provides a lot of relief from symptoms. This is not the same as people who get a lot of piercings and tattoos, primarily because those piercings and tattoos are done for a completely different reason, and they don't carry with them the degree of shame and embarrassment that folks who intentionally self-injure feel. Piercings and tattoos are often also not done impulsively. So, Um, folks who self-injure rarely participate in activities that require changing of clothes. They frequently wear long sleeves or long pants to hide their self-harm. They frequently have few close friends, and a lot of their friends tend to have the same types of behavior. Found in a number of all ethnic groups, and nearly 50% report physical and sexual abuse, but 50% don't. Many report that they were discouraged from expressing emotion. A lot of folks also report a past history of PTSD or borderline personality disorder, and these were brought on by traumatic events in their life, such as on childhood abuse or sexual assault. And one of the reasons this occurs is because due to the dissociation that occurs when you feel powerless before your attacker, the tendency is to dissociate or go to the proverbial fly in the corner type of behavior. And this dissociation becomes very difficult to control, and especially when you're feeling intense emotions and need to kind of get back to a position where you can actually feel yourself physically as a distraction from the emotional pain. And this is where a lot of the cutting and burning comes into play. It's an attempt to relieve emotional pain by returning to a physical being and actually being able to feel it in a different way. And actually, it's felt in a less painful way when it's done through a physical means rather than emotional. So I think these folks take a pick between emotional and physical pain and tend to opt for the experience of physical. So it's not about suicide, it's about relief from pain, anxiety, and fear. It's a behavior from never learning appropriate coping mechanisms. So self-harm and self-injury are different. Self-harm behaviors can occur on a daily basis and have long-term effects. So think about the self-harm from anorexia or the self-harm from drug abuse, alcohol use, those types of things, high risk behaviors. So they're not always as conscious. Other examples of self-harm can be overeating, undereating, smoking, gambling, excessive spending, hypersexuality. So, self injury is different in that it's commonly done to counteract suicidal feelings, alter a mood state from positive or negative, calm and remove overwhelming tension. Sometimes it's for self punishment, to control anger, rage, and dissociation, to ground oneself to reality, and to physicalize what could not be verbalized. Some of the other reasons for self-injury include the need to visualize pain. So some folks feel the need to see blood pouring from their body. So that might be because they're trying to wash away or cleanse themselves from some sort of perceived imperfection. I had a patient once who would cut herself horribly, and she would take high doses of aspirin that would increase her bleeding, and then she would cut herself while she got into the shower, so she would have the experience of watching her blood go down the drain. So this was a terribly, terribly addictive and ritualistic practice that landed her in the hospital many, many times. She cut very, very deeply. And the time that I first saw her, she was 54 years of age. So it's for an anger release. They want to look less attractive, self-punishment. They need to control certain issues. And for some, it feels like it's self-nurturing. Maybe they cut or they burn, and then they take care of the wounds so that they can have an opportunity to care for themselves. It's often done to relieve the feelings of shame, but then the shame returns. So you can see how folks get caught up in this cycle. They feel ashamed, they cut themselves, they feel ashamed for cutting, they cut themselves, so they're a dog chasing their tail. And then, of course, there are psychological motivations. And some folks don't know why they do it. They just recognize that it feels good and it's a relief. So other purposes are, it's an analgesic for stopping emotional pain. It's done to connect body and mind, for control, for cleansing, for self-punishment. And we talked about, combating a sense of invisibility. And the rescue fantasy. They want to cut themselves to bleed so they can be rescued. I think a good example is the movie Fatal Attraction, where Glenn Close, she has borderline personality disorder, and she doesn't want her lover to leave her, so she cuts herself and then hugs him, and she bleeds all over him, and he wraps up her arms and takes care of her, and then spends the night with her because he feels so guilty. So she was able to be rescued and keep her lover present. So some also do it as vengeance. So I'll show you, I'll go cut myself because you hurt me so bad. And the relief in self-injury is frequently temporary. Sometimes it's done to fit in, especially amongst adolescent girls who are, it's basically like a club of self-injurers that's created. And sometimes hurting yourself helps you to feel alive and confirm your existence. It is not for sexual pleasure, gratification, body decoration, religious ritual, cultural compliance, spiritual enlightenment through ritual. It's not about fitting in or being cool, and it's not about suicide. So these are not usual reasons for self-injury. So, three abilities that those who self-injure lack is they lack the ability to tolerate a strong affect or strong feeling. They have an inability to maintain a sense of self-worth and an inability to maintain a sense of connection to others or the environment. Self-injury is commonly associated with personality disorders, anxiety disorders, obsessive compulsive disorders, PTSD, acute stress disorders, dissociative disorders, eating disorders, and impulse and mood disorders. So, warning signs: unexplained frequent injuries, including cuts and bruises. So, often the cuts are inflicted on the wrist, some on the abdomen and on the thighs, but can also be done on other areas of the body that you might not think about. Rarely is it done on face. Overwhelmed by feelings can be a warning sign that they'll cut, or that this person is at risk for cutting. Difficulties functioning at home, work, or school, and an inability to maintain stable relationships. So those can all be warning signs. Dangers. So some can become desperate about a lack of self-control and addictive-like nature of the acts. So it becomes something they depend on to feel good. It might lead to true suicidal attempts, and it may cause more harm than intended. So infections, medical complications, or death. Eating disorders intensifies threat to overall health and quality of life. So that's eating disorders in combination with self-injury. And so here you have the wheel where you can see how feelings contribute to the tension, self-harm, the positive effect, and then the negative effect. So you can see that cognitive behavioral therapy might be very, very helpful at changing this behavior. As soon as they can recognize what thoughts or feelings are contributing to the tension and then the self-harm, then they can intervene in any of those areas of the cycle. So it's there's a lot of stigma associated with self-injury. There's substance abuse and eating disorders. It's a coping strategy used by people who are in emotional distress, and therefore it's not it's heavily stigmatized by society because it's so outside of our our way of being. Nobody likes pain, so why would you like pain? So it's hard for folks to understand, and they think it's just a very bizarre, and that person must be really, really crazy. So, but we need to realize that those who self-injure have feelings that are great amounts of pain and frequently shame. So, injury is a coping mechanism and not the problem itself. So you need to identify what are the feelings, what's the underlying emotional issue in ways that are nurturing and self-constructive instead of self-destructive. So focusing on how that person, when triggered, can avoid self-injury or self-destructive behaviors and then go towards more self-constructive behaviors. So if you're feeling bad, go for a walk. If you're feeling bad and you want to hurt yourself, go in a direction that's helpful for you. Go take a hot bath, wash your hair, have someone blow dry your hair, go get a massage, go get your nails painted, whatever it takes. And you can see that you are comforting yourself rather than being self-destructive. So, of course, friends and family members find it hard to deal with their emotional response to the person who self-injures. So it's important for us to not minimize the problem and recognize that they're not doing it to get attention. It's never a healthy self-injury is never a healthy coping strategy. It shows a sign of poor coping. And you'll see the main diagnosis or nursing diagnosis for these folks is ineffective coping. So don't overreact, and work with these folks and help them to deal with fear, anger, and guilt. And remember, persons who self-injure are really in a great deal of emotional pain and that they're not able to express directly. So the treatment goals are to learn alternative coping strategies. They are emotion-focused, problem-focused, and avoidance. So these are some ideas, and the therapeutic approaches include all types of different treatments. Dialectical behavior therapy we talked about for the personality disorders. Cognitive behavioral therapy we discussed, where you are able to connect thoughts to feelings to behaviors and how you can break the cycle. Exposure response prevention, so avoiding triggers. Eye movement desensitization and reprocessing. This is especially good for those folks who self-injure because of a history of trauma or who have co-occurring PTSD. Hypnosis and relaxation, very, very important. It's a mindfulness exercise that can help you to get connected to your body. Reiki, energy balancing, yoga, Tai Chi. Again, these are mindfulness activities that help you to connect to yourself and stop the dissociative responses. Rational emotive therapy, psychopharmacology can be helpful if you're treating an underlying depression, anxiety, PTSD. So alternatives to SI, basically set up a safety plan. Call your lifeline. That might be getting a sponsor, calling a friend or a therapist. These are some other techniques, like holding ice can give you a physical sensation of pain without causing damage. Eat ice cream fast, give yourself a brain freeze. Meditate, do yoga, take a cold shower or bath. Sometimes drawing red lines with a marker in areas that you typically cut can be helpful. And being able to identify what is hurting so bad that you would rather self-injure than feel it emotionally. So helping people to actually experience the emotions, recognize and utilize tools that help to improve your coping with emotions. So these are some excellent coping strategies. This is a great wheel that we use in clinical settings or group settings, and you work to help people look at all of the things on the wheel that they could do to improve their coping and avoid self-injury. So what we need to know, have appropriate expectations, and but it's hard because adolescents and young people often find it difficult to talk about their feelings and issues that underlie self-injury. It takes time and work, and the key really is to establish a trusting relationship with the patient. So this is not something they're usually going to disclose in early on in treatment. Okay. That concludes self-injury.